Good evening, everyone. This is Dr. Dolopo, and it's been a minute since we had a little discussion on Chinese medicine. Today, we're going to talk about integrative oncology. But before we talk about Chinese medicine and its role in acupuncture and integrative medicine with cancer, we're going to talk about the scarf. Now, if you go to my Instagram channel, I believe it's Elements in Harmony Acupuncture, you can wear a scarf like this, or you can do something fancy, put it in halfway and put it right in the middle. If you're my patient, you know that I have not called in sick for a while, if ever. And it's why am I bringing up the scarf thing? Because back here, there are these points called wind. I just got on my kids about how I don't have the sniffles. I don't have the sniffles. I'm completely not congested, and it's raining outside, and it's been raining a lot this season. And usually between October to March, which we're now in March, it's flu season, it's cold and flu season, not to mention COVID stuff. So we really need to be protecting ourselves, our respiratory system, our lungs in general. I've been studying Chinese medicine since 1994. I've been a licensed acupuncturist in licensed acupuncturist since 1999, and I'm a doctor of acupuncture in Chinese medicine. So what I like to do in these videos is share a little knowledge on how these little things in Chinese medicine can be very helpful for you on a day-to-day basis. Again, we're going to talk about the Journal of Acupuncture and Integrative Medicine, specifically regarding integrative oncology. But before we go on to that, I want to share this, and I told my kids I was going to do this. I just bought my daughter this fancy scarf from Nordstrom. She's in college, so she can look all fancy. And I told her, hey, my 18-year-old, and also my 12-year-old, you got to protect your neck. Bladder 10. That's where bladder 10 is. It's also called celestial pillar. These are my notes from when I was in school. Peter Deadman. Back then, we didn't have these flashcards, which now they're all online. We had a book, and it was a different book that we used. This is a little more modern than when I graduated in 1998. So, but Peter Deadman, Mazen Al-Kafaji with Kevin Baker. Hopefully I pronounce Mazen or Mazen's name correctly. A manual of acupuncture. So I don't know where the accent is. I don't speak Mandarin. Tianzhu, bladder 10, right in the back of the neck, the occipital area. Point of the window of heaven. I'm not going to go into the whole thing. There's quite a bit of information. These are cliff notes, okay? There's pages and pages. But I just want to share with you one of the actions that it does is it pacifies wind. When we catch a cold in Chinese medicine, we call it attack of wind cold, or attack of wind heat. So that's bladder 10. We're not going to spend too much time on this. Another point in the bladder meridian, Yuzhen. I don't know where the accent is. Jade pillow. It expels wind and cold and alleviates pain. So for people, when you catch cold when you catch a cold, when you're out there, it's about 68 to 72 degrees in any house you're in or building if the temperature is regulated to what we typically like. If you go into any office building, it's typically around 68 to 72 degrees. I keep it around 69 to 71 degrees in my office. You walk outside and there's a temperature drop anywhere between 40 to 60 degrees outside. In the morning, it's been a little warmer than it has been. It's around 55 degrees. But this whole season, it's been less than that. And that's the benefit of having a card. You can see the temperature in your car. So when you're dropping from 70 degrees to 50 or 70 degrees to 40, your muscles tense up. Your muscles will tend to tense up. It contracts. Your muscles will contract. These points, especially there have been some windy days, this is Chinese medicine, okay? Acupuncture part's been alive for about 2,000 plus years, and Chinese medicine itself is about 6,000 years, whatever. So for thousands of years, We've been saying in Chinese medicine, attack of wind. Guess where bladder 10 is? Bladder 9. Just above the occipital area. So the posterior part of your head. There's 2 more cards. Feng Fu. I don't know where the accent is. Palace of Wind. This is on the governing channel, right in the center line in the back. Guess where it is? Right there, the occipital area. What is one of the actions that it does? Eliminates wind. Wind, wind, wind. It will attack your wind. The wind will attack your back of your head. So if you're driving a fancy, car with the top down and it's windy, you might catch a cold or at the least have stiffness of the neck. One more card, gallbladder 20. It is lateral to the bladder channel. This is the gallbladder channel. So there's the governing channel midline. Lateral to that is what's called the urinary bladder line. Lateral to that is the gallbladder channel. So this is called feng qi. Feng means wind. I don't know where the accent is. Feng. Gallbladder 20. Eliminates wind. Wind. Eliminates wind. Eliminates wind. Expels wind and cold. Calms us, pacifies wind. All these are wind points. So I'm going to go put it back in my little box here. So wear your scarf. Go to my Instagram channel, Elements in Harmony, and you'll see my logo of my other business. It's a lioness, and you will see that there is a video on wind. It's 60 seconds. I really talk about wearing a scarf. All right, so I have like 2 scarves in my office, in my car. So what I want to do with this video is with this material, there's a lot of articles, and I'm just going to go through the abstracts. You know what I'm going to do right now is there are a few testimonials of some of my oncology patients who are still alive, and that's very important. Quite a few years ago, several years, I want to say at least 5 years now, 4 of my friends died from cancer. Or one from a very severe issue, failure of the kidneys, and a whole host of severe internal health issues, and he died on my birthday. And the other people in my life that year died from cancer. So I take cancer very, very seriously. I have family members who are dealing with cancer and are surviving. They're survivors. That year that my dear friends, including one close friend who died on my birthday in December, that same year I was facilitating in the improvement of the life quality of 4 oncology patients. They were going through chemo, radiation, whatever they're going through with their oncologist, and I was helping with improving their quality of life. And they're still alive. So I'm going to read one of the testimonials. If you go to elementsinharmonyacupuncture.com, you'll see testimonials, internal issues right in the middle, and you'll see lung cancer survivor. So elementsinharmonyacupuncture.com/lung-cancer-survivor. Surviving stage 4 lung cancer. Her picture, here's me living life in part due to your treatments. You helped me with my side effects more than you can know, as well as my mental well-being. That's what acupuncture can bring to the table. I have other patients who've gone through oncology treatments, and at this point, at 24 years of practice and being in my late 40s and seeing people having suffered and surviving and thriving despite their cancer diagnosis, it seems a lot like it's survival of the fittest. And what I think Chinese medicine brings to the table is that nausea, any side effects from any of the medications, being able to go through the oncology therapy, go through the chemo, go through to the radiation, not lose so much hair, help their hair grow back faster, keep their mental attitude well, help them sleep, like I said, the nausea, be able to eat, have good energy, be in good spirits, be mentally alert. I think acupuncture does a lot with bringing quality of life into therapy. I don't personally prescribe herbs when people are going through chemo and radiation. I just focus on acupuncture. Besides being a doctor of acupuncture and Chinese medicine, I'm a senior student of the late Grandmaster Dr. Richard Tefutan. And this right here is my gold level certificate. My doctorate is outside. My master's degree is there. My licenses are everywhere else. But this stays right here in my office. This means a lot to me. I'm a gold level certified balanced method acupuncturist, and I was taught very, very well by my master, my late master, Dr. Tan. So I do balanced method. I did traditional Chinese medicine. It's been around since 1959. I did TCM from 1999 to 2006. That's what I was. That's my master's degree. My doctorate is all based on research, but my work with Dr. Tan, the gold level certificate, is on the work that I received with him while he was alive. I met him in 2006 and he passed away in 2015. So when I read these testimonials, like there's one more that I know of here on this particular website. This is my third website. There's one on breast cancer survivor. I'll read her testimonial. After a yearly routine mammogram, I was diagnosed with type 2A breast cancer and had to undergo surgery, chemotherapy, and radiation. I started to see Anna the week before my first chemo and continued to be treated by her every 3 weeks for an entire year. She helped reduce my side effects, strengthen my immune system, and alleviate my pain. My doctors were amazed at my results and how quickly I healed. I have been cancer-free for almost 4 years, and I continue to see Anna monthly to keep my body healthy and happy. She wrote this a few years ago, at least a couple years now, or one, I want to say more than 1 or 2 years ago. So I will tell you exactly when she started with me. This particular patient started with me, we'll call her O, and she started with me 2018. And she still sees me. This is not up to date, but as of November 15, 2022, she saw me 57 times. And I will tell you that she's been with me consistently since then. Since November, she has seen me. That was November 22, which was number 57. And she saw me November 15, 57, 58, 59, 60, 61, 62, 63, 64. So she has seen me, or 63 treatments as of February 22, 2023. So thank you for letting me look that up. So that's how much that particular patient values our work together. I'm sharing this because there are some of you, many of us, let me see, my sister-in-law's a nurse. She's a clinic director at UCSD, and she says it's not necessarily if you get cancer, but when, and hopefully, some of us stay away from it. I really believe it has a lot to do, I don't know, but stress does not help. Stress does not help heal a person quickly. I do see when people are suffering from stress that the cancer just kind of makes things worse. But the more we can keep people calm, they seem to be able to go through the oncology treatments much with less symptoms. So, table of contents. Hopefully I didn't say anything wrong there. I just want to say stress just helps keep everything calm and helps people get through the oncology treatments much better. So that's what I bring to the table, is keeping the stress down. So I'm just going to share with you a table of contents, and I'm just going to read the abstract, okay? So that's just like a little synopsis. So when this Journal of Acupuncture and Integrative Medicine, published by CSOMA, which is California, I'm part of CSOMA, California State Oriental Medical Association. So the first chapter is the table of contents, Acupuncture in East Asian Medicine and Integrative Oncology. The second article is Chinese Medicine, Oncology, and Immunology, Colorectal Cancer, a case study, Aspects of Immunity and Cancer in an Integrative Medicine Context, Cancer Terminology and Chinese Medicine Texts, the transformative role of Chinese medicine and acupuncture in palliative and end-of-life care, the integrative medical treatment of ovarian cancer stage 3, a case study, and acupuncture for treatment of post-radiation skin lesions in stage 4 triple positive breast cancer patient, a case study. So these are great articles. Before we go into this, I do want to share that if you go to elementsandharmonyacupuncture.com and you go to the pain section, testimonials pain, you scroll down and you see pre-surgical care hysterectomy. This particular woman was with me for years, and we'll call her W. And she put her initials, WJ. I'll just read it to you. Pre-surgical care hysterectomy. Hi, Anna. Wanted to share my experience with my recent surgery with you. Because of an increased risk of both ovarian and uterine cancer, I had a prophylactic removal of ovaries, tubes, her fallopian tubes, cervix, and uterus. I was advised by my surgical team, as well as quite a few women who had the surgery, that I would be in great pain and walking hunched over. You and I talked, and you recommended I get acupuncture treatments prior to the surgery, as it would help avoid pain and was more important than coming after surgery. We had several sessions prior to my surgery, and I'm so happy to report what amazing recovery. I was discharged from surgery 2 hours after walking completely upright. I never had to take a single pain pill. The nursing staff who checked in with me could not believe that I did not have to take the prescribed tramadol. But I also did not even need to take ibuprofen. The day after the surgery, I was able to take the dog for a walk up and down the street, no problem, picture attached. No one believes me that my recovery has been this amazing, but I know you do. Thank you so much for making this an easy and pain-free experience. Let me reread that second paragraph, and you can check this out. elementsandharmonyacupuncture.com/pre-surgery-hysterectomy. We had several sessions. I recommend at least 10 treatments prior to surgery. I think we did like 6 or 8 because I only had 2.5 weeks before. I like to do at least 10. She had an amazing recovery. She was discharged from surgery 2 hours after walking completely upright. That's on the same day. She never had to take a single pain pill, and she never had to take a prescribed tramadol. And she didn't even have to take ibuprofen. So in this case, she did not have cancer. She was doing prophylactic surgery due to increased risk of both ovarian and uterine cancer. So that's very helpful to share. So some of these doctors had written some great. Let's read the first one, which is Chinese Medicine, Oncology, and Immunology. That's fun, right? Oh, I think that's I want to read these because I want to share with. Here's the first one. Okay. Acupuncture and East Asian Medicine in Integrative Oncology. I am only going to read the abstract of each of these. This is by Jani Wen Sao. So her email is drjannysao@gmail.com. That's Dr. Dr. Janny, JANNYCAO@gmail.com. The abstract of this paper is Integrative Medicine combines conventional Western medicine with complementary and alternative treatments. It is a practice that is informed by evidence to facilitate the body's innate healing response. Integrative oncology allows precision in a therapeutic approach that is natural and less invasive. It emphasizes the therapeutic relationship between practitioner and patient and is an effective intervention in cancer treatments and patient care. Medicine is personalized when we account for genotype, patient preference, and expectancy, Acupuncture and herbal medicine have exemplified personalized medicine for over 3,000 years, with the results supported by growing evidence in clinical findings with supporting symptoms like cancer pain, fatigue, and insomnia. East Asian medicine is a healing-oriented medicine, a lifestyle medicine that includes nutrition and diet, stress management, as well as a balance of mind, body, spirit. The nature of customization within acupuncture and East Asian herbal medicine is an ideal model for personalized patient care in integrative oncology. Through clinical findings, it shows promise to increase effectiveness of cancer care and promote health for cancer prevention. So that is the first paper, abstract of the first paper I want to read. And I'm going to go to pubmed.gov and I'm going to look up acupuncture and cancer. How about acupuncture and cancer pain? So there are 733 results between 1973 and 2023. Let's bring this to 2000, so the last 23 years including. So there are 706 results. Let's see. The first one, I'm just going to look at one. Hopefully it's something positive. Clinical evidence for association of acupuncture and acupressure with improved cancer pain. A systematic review. This was published 2020 in JAMA. Journal of American Medical Association. I believe that's what it stands for. So, it is called, so I just gave you the title. Again, clinical evidence for association of acupuncture and acupressure with improved cancer pain. A systematic review and meta-analysis. So I'm just going to share that here for my own, so I can cite these. If I'm going to publish this on YouTube. All right, results. A total of 17 RCTs with 1,111 patients. Randomized control trials. That's what an RCT stands for. So there were over 1,111 patients were included in the systematic review, and data from 14 RCTs with 920 patients were used in the meta-analysis. 7 sham-controlled RCTs, 35% were notable for high quality, being judged to have a low risk of bias for all their domains. Okay, so let's go straight to conclusions and this systematic review and meta-analysis found that acupuncture and or acupressure was significantly associated with reduced cancer pain and decreased use of analgesics, although the evidence level was moderate. This finding suggests that more rigorous trials are needed to identify the association of acupuncture and acupressure with specific types of cancer pain and to integrate such evidence into clinical care to reduce opioid use. That's on PubMed. So what you do, so I'm just going to cite it, pubmed.ncbi.nih.gov/31855257. And all you do is go to PubMed and type in acupuncture, and in big letters and in small letters cancer. So I hope that helps. So let's go on to the next. This is going to be a long article, a long video, but hopefully helpful to those of you who are interested in understanding the value of acupuncture and Chinese medicine with, integrating with oncology treatments. So this one is Chinese Medicine, Oncology, and Immunology, Colorectal Cancer, a Case Study by Dr. Erlene Chang et al. She's in El Cerrito. Corresponding author is Jasmine Oberst. Jasmine, JASMINE.OBERSTE@gmail.com. There are some co-authors on this as well. The institution was Doctoral Program, American College of Traditional Chinese Medicine at CIIS, San Francisco, United States. This first one was just the professional writing it. All right. So in this abstract, This case study on colorectal cancer, CRC, demonstrates how Chinese medicine, CM, and other integrative therapies can help ameliorate symptoms of the disease and of the side effects of conventional treatment. An illustrative example of a 68-year-old female with an advanced diagnosis focusing on the use of acupuncture, Chinese herbs, functional medicine, dietary and lifestyle adjustments, as well as chemotherapy, and her decision to discontinue the drug approach moving forward. This case celebrates the individual choices that patients have when facing complex diseases and the importance of having a robust, integrative medical team supporting one's healing journey. Wow. I'll let you read that on your own. Do get yourself a copy of the Journal of Acupuncture and Integrative Medicine. They're located at 548 Market Street, number 68552, San Francisco, California, 94104. I just got this today. I really love this. Executive Director is Dr. Ra Adcock, Doctor of Acupuncture and Chinese Medicine and licensed acupuncturist. So if you want to know what a DACM is, it's what I am. I'm a Doctor of Acupuncture and Chinese Medicine. And anyone who practices in the United States of California has to be a licensed acupuncturist. So you also have a bunch of acupuncturists and a Doctor of Acupuncture and Chinese Medicine and naturopathic doctors and the editor-in-chief. So there's a whole list. The editor-in-chief is Dr. Jordan Wheeler, Doctor of Acupuncture and Chinese Medicine and licensed acupuncturist. So the sponsor of this, all of this is CSOMA, California State Oriental Medical Association. If you want to go to CSOMA, California State Oriental Medical Association, their website is csomaonline.org. So everyone knows that they are being cited. All right. Thank you for sticking with me. These are great papers published. A lot of tables. All right, let's go to the third. So please get your own copy because this is really valuable. So the third paper that was published is Aspects of Immunity and Cancer in an Integrative Medicine Context by Annette Cole, licensed acupuncturist, Doctor of Acupuncture and Chinese Medicine, Master of Science of Oriental Medicine. So we have different masters. So mine is Master of Traditional Oriental Medicine. It depends on the school, however they decide to give you. So you'll see MTOM, which is what I have, or MSOM, which is what she has. You'll see Doctor of Acupuncture and Chinese Medicine, Doctor of Acupuncture and Oriental Medicine, Doctor of Oriental Medicine, or old school Oriental medical doctor. So you'll see different things. And other, like Canada, it's registered acupuncturist. We have different titles all around the world. All right, so the abstract of this Aspect of Immunity and Cancer in an Integrative Medicine Context is, when considering different medical systems and the approach to biological identity, immunity, and disease processes, it is important to determine the meaning of different terms. Biomedicine and traditional Chinese medicine use different language that is not exactly translatable for immune system, psyche, nervous system, and in relation to cancer disease processes, which can reflect different understandings and approaches to treatment. However, new advances in the field of oncology, body terrain, tumor microenvironment, psychoneuroimmunology suggest important ways that biomedicine and traditional Chinese medicine intersect and can mutually enhance each other. So when I talk to my patients in general, and I've been saying this for the last 24 years, which is, when I say kidney chi, I'm not talking about your kidneys. And I'm not going to define I only have like 20 to 50 minutes to talk with them privately. My initial patients are here for 1 to 3 hours with the needles. So we're going to talk privately for 20 to 50 minutes, and I got to be like, very concise and to the point, and looking at their paperwork and very comprehensive. But just know that when you talk about your liver energy to a, with your licensed acupuncturist, with your doctor of acupuncture in Chinese, whatever the title is, Eastern medical doctor, specifically regarding Chinese medicine, when we say kidneys, we're not talking about your kidneys from a Western functional definition. We're talking about the energy of your kidneys. So your practitioner can break this down more, but that's what this article is about. Basically saying we have different language that is not translatable for immune system, psyche, nervous system, and in relation to cancer disease processes. Okay? So that's a great article. I'm glad they brought that up. A little thing about Annette Cole. She received her DACM from American College of Traditional Chinese Medicine at CIIS. So ACTCM is the first, if I'm correct, is the first Chinese medical school in all of California. And her MSOM from Acupuncture and Integrative Medicine College, Berkeley. She came to Asian medical studies from a background in massage therapy and the humanities and creative arts. She currently lives in the beautiful Tucson Mountains, or Tucson Mountains, I don't know how to pronounce that, and practices acupuncture at Cottonwood in Tucson, or Tucson. How do I pronounce that? Tucson. I want to say Tucson. It is Tucson. A rehabilitation center treating addiction and mental health concerns. So that's her background. Let me see the background of these other people before we go on. Sometimes it's nice to know about... So the colorectal cancer, these are all the people that are parts. I'm not going to read all their... I'll just read the main doctor. Erling Cheng, Doctor of Acupuncture and Oriental Medicine, licensed acupuncturist, has been practicing TCM since 1985. Her service and experience in the field of oncology includes the following: President of American Cancer Society, California Chinese Unit, Vice President, American Cancer Society, California Chinese Unit, Senior Administrative Director. That's impressive. There are a bunch of other people here too, so I won't spend time going through that, but please get this amazing journal. Dr. Janie Chow, I don't know how to pronounce her name, has been practicing and researching modalities in medicine for the past 2 decades. Her clinical practice is well recognized among cancer patients. She has specialized in mental and emotional health and an award winner in herbal medicine. Dr. Cao holds degrees in international business management, doctorate in herbal medicine and acupuncture. Her training at Harvard Medical School includes certifications in precision oncology and professor in medicine. Quite impressive. Wow. I can see why they put her article first. You have a Harvard graduate. All right, so let's go on to the next paper, shall we? Cancer Terminology in Chinese Medicine Texts by Robert Hoffman, Doctor of Acupuncture and Oriental Medicine, licensed acupuncturist. There are a bunch of corresponding authors, and I will read to you. There's Dr. Hoffman and Jian Li Gao, PhD, Academy of Traditional Chinese Medicine, Zhenjiang Chinese Medical University, and co-author is Fei Chen, Yosan University of Traditional Chinese Medicine. I read those because there are only 3 as opposed to the other one. There are quite a few. Let's see. The abstract. So you know what I'm going to do is I'm going to go back to that original one later and read them all. I just want to get through these just so we can give credit to all of the authors. In China, traditional Chinese medicine is an accepted and integral part of clinical cancer management alongside Western medicine. Let's reread that. In China, so this is the abstract of Cancer Terminology in Chinese Medicine Text. In China, traditional Chinese medicine is an accepted and integral part of clinical cancer management alongside Western medicine. Fuzheng, I don't know where the accents are. Fuzheng therapy is utilized to support the patient's healthy qi, zheng qi. Keep in mind, I don't know where any of the accents are. I don't read Chinese. Or the immune system while dispelling xie qi, or pathogenic influences. However, the study and description of cancer within Chinese medicine and literature can be traced as far back as the Shang dynasty, where it was described as liu, tumor or lump. Herein we will examine the terminology and understanding of cancer from Chinese medical literature, tracing the evolution of knowledge and language used in cancer diagnosis. Well, there you go. So, let's see. Let's read. Robert Huffman holds a master's degree from Johann University. Oh, Jan Li Sao received her PhD from the University of Macau and completed a postdoctoral fellowship at the University of Chicago. She is currently a senior researcher at Zhejiang Chinese Medical University, where she supervises master's and PhD students in herbal research focused on the immune system and oncology. She is also editor-in-chief and the peer-reviewed editor-in-chief of the peer-reviewed journal Evidence-Based Complementary and Alternative Medicine. That's a huge journal in our medicine. Robert Hoffman holds a master's degree from Yosan University and his doctorate from Five Branches University. I believe Five Branches is in Santa Cruz, but I could be wrong. Where is Five Branches? Five Branches University. It's in Santa Cruz. I believe Santa Cruz, San Jose, those are the campuses. Let's see. Make sure that's not my child. All right. So he holds also, currently he is also a PhD candidate at Zhejiang Chinese Medicine University in Hangzhou, China. His research is in the use of mushrooms as adjuvant therapy in cancer treatment and the role of Chinese herbs in T-cell regulation. Dr. Hoffman is the chief academic and clinical affairs officer at YSU, Yosan University, where he also serves on both the master's and doctoral faculties. So Yosan, I believe, is in Los Angeles. Yosan University. It's in, let's see. 310, that's a Los Angeles. Yes. Washington Boulevard. Fei Chen is pursuing her master's degree in traditional Chinese medicine at Yosan University as a transformational recovery coach. She has extensive background in clinical training, holistic healing modalities, and a lifelong commitment to helping others return to their true sense of self. She has a BA in economics and served in the U.S. Army, working a 459-day deployment to Iraq. So soon to be Fei Chen, thank you for your service. Thank you for working in the U.S. Army. My dad was 20 years in the U.S. Navy and 459-day deployment in Iraq. That is quite impressive. Highly trained and very valuable doctors who worked on these. Blue Poppy has an article. These are some of their herbs. Just thought I'd share that. I buy my acupuncture needles from them and some of their herbal formulas as well. Let's see. The transformative role of Chinese medicine and acupuncture in palliative and end-of-life care. That's always a difficult conversation, right? This is by Kim Perano, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist. She is in San Rafael, California. Kim.perano@gmail.com. That's kim.peirano@gmail.com. Before I go on, you can contact, let's see, Dr. Hoffman at robertd.hoffman@icloud.com. You can contact Dr. Gao at JIAN Ligao at zcmu.edu.cn. And I believe I gave the information for Annette. But if you want to, I mean, these are great articles for those of you who are listening to this and a particular article or particular paper really speaks to you. You might want to communicate with these doctors and practitioners because they are making themselves accessible. All right. The transformative role of Chinese medicine and acupuncture in palliative and end-of-life care. The abstract. This is a pretty long abstract. Thank you for being with me so far at 40 minutes. An undeniable reality of working with cancer patients is that some patients will not survive their diagnosis. Chinese medicine and acupuncture have the ability to significantly improve the quality of life of terminal patients. Many barriers exit that block the use and acceptance of acupuncture as a tool for end-of-life care, including lack of awareness of the modality, funding, and insurance coverage. In addition to the ability to treat side effects of medication and disease along with the pain associated with death, acupuncture helps reduce anxiety, stress, and helps patients find peace in the dying process. As practitioners working with patients with potentially terminal disease, it is critical to place focus on our ability to hold space for the healing process through death, as it is for the healing process through the curing of disease. An undeniable reality of working with cancer patients is that some patients will not survive their diagnosis. The role of Chinese medicine and acupuncture in palliative and end-of-life care is by no means as researched or studied as the care and treatment of disease and illnesses like cancer, but its role is powerful, impactful, and has the ability to significantly improve the quality of life of terminal patients up until their transition. Many barriers exist that block the use and acceptance of acupuncture as a beneficial tool for end-of-life care, including lack of awareness of the modality, funding, and insurance coverage. In addition to the ability to treat side effects of medication and disease, along with the pain associated with death, acupuncture is an excellent modality to help patients reduce anxiety, stress, and find peace in the dying process to ultimately die a good death. Inherent with acupuncture, elemental theory is the process of the transition from birth to death and the cycle of life, associated emotional states, and opportunity for healing. By deepening our understanding of the connection this medicine has not only the physical body, but the mind and spirit, we have a unique opportunity to help our patients not only experience relief of pain and suffering, but also an impactful and meaningful transition. As practitioners of acupuncture and Chinese medicine, working with patients with potentially terminal diseases, it is just as critical to place focus on our ability to hold space for the healing process through death as it is for the healing process through the curing of disease. So that is the abstract for this paper that was published. That is such a powerful abstract. Dr. Pirano goes through, I'll probably do a video just on this because on Sunday, my two younger children and I, they're 12 and 5, we went to visit my friend who had a stroke, and she's been living in a rehab center since November, and it is currently March. And I didn't know that it was mostly a state-run facility. And I'm going to visit her again and give her comfort, and it can be lonely. She shares the room, and many people don't know this, but when I was an intern in the 1990s, I was in my early 20s, and I focused, it just turned out that most of my patients were post-stroke patients. And I saw the power of acupuncture and Chinese herbs on post-stroke patients. And then for Samahan Community Medical Clinics, they were created by Filipino medical doctors in the 1970s in San Diego, one in Mira Mesa and one in National City. I worked there. I was their first licensed acupuncturist. And I was there for a little bit of time. And my patients were post-stroke patients. That was the beginning of my career, 1999. I have told stories of how I went. We didn't have the internet, not like we do today. And I went through the yellow pages, and I went through both the white pages, but especially the yellow pages. I went and looked at all the community medical clinics because my goal was to be like Patch Adams and to give. And the moment I said I was an acupuncturist, I wanted to give my acupuncture services for free. They hung up on me. And now I have students who are working in these FHQCs. So an FHQC is a state-run, it's federally funded FHQC, meaning, so federally qualified health center. So when we went to visit my friend in what seems clearly to be an FHQC, there were a lot of end of life. This is palliative care for many people. Like, they're going to die there, probably. And I didn't know this. And my 5-year-old and 12-year-old were exposed to this, which I don't think is a bad thing. They get, they see part of the cycle of life. I just didn't warn them beforehand. We went there to go see my friend. So they don't need to go again. I'll just go by myself. This is a great paper. I'm not going to read all of it, but I will talk about the elemental emotions of death. She talks about water, fear and wisdom, wood, anger and forgiveness, metal, grief and release, earth, worry and connection, fire, joy and journey home. Great article, Dr. Pirano. So let me just read to you who Dr. Pirano is. She's a doctor of acupuncture and Chinese medicine, a licensed acupuncturist. She's a practicing acupuncturist and transformational life coach in San Rafael and Oakland, California, a member of the clinical faculty at AIMC, Berkeley, the founder and director of the Integrative Healing Institute, and a professional director for the California State Oriental Medical Association. Kim's healing and education philosophy is to help people access the inner workings of the mind-body-spirit axis, allowing them to experience a deepening connection to their higher self and inner wisdom. To learn more about her, please visit lionsheartwellness.com and the integrativhealinginstitute.com. So, great paper, Dr. Pirano. The next one is the Integrative Medical Treatment of Ovarian Cancer Stage 3, a case study. This is by Dr. Erlene Chang, et al. So, let's see. There are quite a few authors. Let's read about the doctor really fast. It's the same doctor of Acupuncture and Oriental Medicine, NCCAOM Diplomate of Acupuncture and Oriental Medicine. She is a doctoral professor of oncology and Chinese medicine at the American College of Traditional Medicine at the California Institute for Integral Studies. She practices in El Cerrito and specializes in the integrative medical treatment of oncology through acupuncture, Chinese herbal medicine, and Qigong. And there's also Dr. Bethany Letty, is a licensed acupuncturist and a doctor of acupuncture and Chinese medicine, and NCCAOM Diplomate of Acupuncture. She practices in New York City and Tuckahoe, New York, and specializes in fertility, prenatal care, musculoskeletal disorders, and chronic viruses. So when you see NCCAOM Diplomate of Acupuncture, so that's what I am also. Board certified is basically saying. So that means it covers many states. most of the states of the United States of California. Dr. Jocelyn C. Jackson is a licensed acupuncturist, doctor of acupuncture and Chinese medicine, and NCCAOM Diplomate of Acupuncture and Oriental Medicine. She practices in Los Altos and specializes in women's health and pain management. And then another co-author is Dr. Emily Sablowski, is a licensed acupuncturist, doctor of acupuncture and Chinese medicine, and NCCAOM Diplomate of Acupuncture and Oriental Medicine. Dually a trained historian of the history of science and medicine, she practices in San Diego and specializes in dermatology and nervous system regulation. 4 amazing doctors there. So let's see. If you want to contact, there's one email for Dr. Bethany Letty in El Cerrito. Bethany, Bethany, A-C, P-U-P-U-N-C-T-U-R-E @gmail.com. I don't know if that is correct. I don't know if she meant to put that, or if it's Bethany Acupuncture @gmail.com, or if it's supposed to be Bethany A-C-P-U-P-U-N-C-T-U-R-E. So I don't know if that's a correct spelling, but you can look her up. Dr. Bethany Letty. Let's see. Ovarian cancer is the most lethal cancer of the female genital system worldwide. In the last 10 years, survival rates, also you can call it SR, of ovarian cancer patients have not improved. Typical SR of stage 3 ovarian cancer patients are between 2 to 5 years. Integrative medicine offers an opportunity for ovarian cancer patients to incorporate their modalities of treatment into their care. This case study examines an integrative medicine treatment of a stage 3A high-grade serous carcinoma ovarian cancer patient with acupuncture, Chinese herbal medicine, and Qigong from the time of diagnosis in 2016 through 2022. Over the past 6 years, this patient has improved symptoms, including maintaining a low CA 125 level, and lived past the typical 5-year period of patients with similar forms of ovarian cancer. Further research is needed to determine if an improvement to survival rate of ovarian cancer could be achieved when integrative medicine incorporates acupuncture, Chinese herbal medicine, and Qigong into treatment. Speaking of Qigong, if you go to elementsinharmonyacupuncture.com and you go to videos and you scroll down, you'll see Qigong and you'll see Qigong research. So go to Qigong research and you go to Qigong and COVID-19. This is on pubmed.ncbi.nlm.nih.gov/32425471. And this was published 2020. I'm going to share this with one of my pages right now. So, what this article was published in the American Association for Geriatric Psychiatry. And it says in its abstract, part of it says, given these traits, Qigong has the potential to play a role in the prevention, treatment, and rehabilitation of respiratory infections such as COVID-19. I'll just let you read that there. So again, if you want to see that on my website, go to elementsinharmonyacupuncture.com/Qigong-research. Qigong is spelled Qigong. So that's a very interesting case. You'll see in these papers that they're showing the tongue. The tongue shows some very interesting information with all of us. This is great because they really go into some great tables for especially doctors of acupuncture and Chinese medicine, practitioners of Chinese medicine, licensed acupuncturists, to read from and really understand what they did. So the next paper is Acupuncture for Treatment of Post-Radiation Skin Lesions in a Stage 4 Triple-Positive Breast Cancer Patient, a case study by Lisa Nicholson, Master of Science of Traditional Oriental Medicine, licensed acupuncturist, 6th Avenue, San Diego, my home city. Lisa at Balboa Park Holistic Wellness Center.com. Abstract. This case study of a 33-year-old patient with stage 4 triple positive breast cancer illustrates how acupuncture can be used as an adjunct therapy for late-stage breast cancer, helping to improve quality of life by relieving pain and other symptoms of the cancer and treatment side effects. So let's see who Lisa is. She's been in private practice in San Diego for over 20 years and is CEO of Damahua, L.Ac, a company dedicated to educating acupuncturists and other healthcare providers about the use of cannabis in 21st century Chinese medicine. As part of a general practice, her passion lies in helping patients to live as fully as possible while undergoing cancer treatment. Other focuses include menopause management and providing pain management and PTSD relief to veterans. Very nice, Lisa. She can also be reached by email at lisa@balboaparkholisticwellnesscenter.com. So I want to, I read about many of the authors here, but I think it would be very helpful to learn more about the other doctors. CSOMA, the mission statement, is a professional association of licensed acupuncturists and supporters of acupuncture dedicated to the preservation, advancement, and integration of the art, science, and practice of all branches of acupuncture medicine into the modern healthcare model in a caring and ethical manner, thereby enhancing the health and well-being of the general public. The editor-in-chief wrote a great, I think Dr. Jordan Wheeler did a great job. I'll just read a part of the letter from the editor. I think that would be very beneficial. Nearly everyone has been affected by cancer in some way, whether a personal diagnosis or the diagnosis of a friend or family member. According to CA, a cancer journal for clinicians published by the American Cancer Society in 2020, the most recent data available, there were an estimated 19.3 million new cancer cases in the 10 million cancer deaths. Female breast cancer has surpassed lung cancer for the most diagnosed cancer worldwide. Chinese medicine has a long history of treating both the root and branch of cancer. The word tumor has been discovered on oracle bones dated 3,500 years ago, and discussions of cancer appear in the Huangdi Neijing and the Huangdi Bashi Nanjing from 2,000 years ago. Amid the intersection of conventional and traditional medicines, Chinese medicine practitioners cannot claim to treat or cure cancer, but we can still offer much to oncology patients. What our medicine does provide is support. It provides support from side effects of patients undergoing chemotherapy and radiation. It provides support to patients opting out of chemical treatments, and it provides palliative support for those nearing end of life. The articles published in this exciting issue of JAIM trace the history of cancer terminology and Chinese medicine. Texts detail the crossroads of integrative oncology, provide the understanding of acupuncture in support of end-of-life care, and follow case studies of positive treatment outcomes utilizing acupuncture and Chinese herbal medicine. And Dr. Wheeler ends it with, my hope is that the knowledge and experience contained in this issue supports traditional Chinese medicine practitioners in becoming more comfortable treating oncology patients, and that conventional medicine providers will read these pages and understand the significant impact our medicine can have in the health of oncology patients. While our medicine is ancient, we must still do our best to educate the public, patients, and providers on all aspects of traditional Chinese medicine. It is then that our profession grows. Hopefully these pages are a step in that direction. So I've done a lot of videos on different kinds of things, fertility, women's health, pain-related, immune system. When I received this today in my office here at Elements in Harmony in Laguna Hills, Orange County, Southern California, I can't tell you how excited I am to have seen this, because I just feel that, we all need education, and we don't know what we don't know. So I think it's important that we elevate our profession as Eastern medical practitioners and doctors. And the reason why I'm also sharing, I'm about to share the peer reviewers, and I'm about to share the other authors who helped publish these amazing papers, these articles, because I want everyone to know that I appreciate you personally from the bottom of my heart. And I personally have lost people, friends. My daughter, Anais, her name is Anais Isabella Josephine. She's named after Joe Blanc. So, thank you. So, I want to, the peer reviewers include Dr. Hoffman. I shared, his description is a little longer in this one. Robert Hoffman is currently the Chief Academic and Clinical Affairs Officer at Yosan University in Los Angeles, where he serves on both the master's and doctoral faculties. He received his master's degree in traditional Chinese medicine from YSU and completed his doctoral degree, DAOM, at Five Branches University. In addition, he is currently a PhD candidate at Zhejiang Chinese Medicine University at Hangzhou, China. I'm very sorry that I'm butchering these Chinese words and names. His research is in the use of mushrooms as adjuvant therapy in cancer treatment and the role of Chinese herbs in T-cell regulation. In addition to his work at the university, Dr. Hoffman serves on the board of Accreditation Commission for Acupuncture and Herbal Medicine, also known as ACAHM. He has written numerous articles on Taoism and Chinese medicine and serves as editor and peer reviewer for several integrative medicine journals. So that's the first peer reviewer. There are 1, 2, 3, 4, 5. Ji-Ling Lin, licensed acupuncturist, herbalist, and yoga teacher. Her integrative medical practice in Ventura, California, nourishes wellness for all people, specializes in sports acupuncture, women's health, and chronic illness. She is faculty for Esalen Institute. I don't know if I'm correct pronouncing that. Esalen or Esalen. Balanced Rock Foundation's yoga teacher training and Artemisia Academy's herbal apprenticeship program. She writes for Mountain Rose Herbs and various publications, records monthly podcasts on herbal radio, and teaches classes ranging from seasonal wellness to multi-day backpacking expeditions. Ji-Ling's wilderness adventures re-inspire her mission of providing the best integrative medicine and experiential education to empower thriving health and environmental stewardship in our bodies, communities, and world. Visit Ji-Ling at jilinglin.com, JILINGLIN.com. The third peer reviewer is Mike Morgan, licensed acupuncturist. He's board certified as a Diplomate of Oriental Medicine and Acupuncture, NCCAOM. Mike Morgan has been practicing acupuncture and Asian medicine for over 20 years. He is a graduate of the Maryland Institute of TCM, where he studied acupuncture. And he is a graduate of the American College of TCM in San Francisco, where he focused his training in Chinese herbal medicine, dermatology, post-trauma treatment, and allergy and epidemic diseases. Currently, Mike is an adjunct professor and clinical supervisor at ACTCM and was a dean of clinical education and clinical director at AIMC Berkeley. Mike was a board member of CSOMA as well as treasurer and president of CSOMA. Mike has a private practice in Alamo, California. And Kim Perano, DACM, L.Ac. Let's revisit her. She is a practicing acupuncturist and transformational Dr. Jungian coach. I don't think it's Jungian. I think it's Jungian coach, Jungian, the philosopher, right? In the San Francisco Bay Area, she is a published author, speaker, and intuitive healer. Dr. Kim's treatments and offerings aim to access the deep inner workings of the mind, body, spirit, connection to help her patients unlock the root cause of disharmony. Dr. Kim is the founder and director of Integrative Healing Institute, a nonprofit education and research institution with a mission to help educate practitioners and the general public of the connection of the spirit, mind, body, and healthcare. In private practice, she treats patients for trauma, major life changes, end of life and terminal care, and spiritual growth, as well as pain management and sports medicine. As transformational coach, her work centers around helping her patients develop self-awareness, confidence, and the ability to transform their problems into opportunities. In all of her work, Dr. Kim aims to help people gain more awareness and curiosity, two aspects of the human experience that are required for growth and healing. For more information, please visit lionheartwellness.com and theintegrativehealinginstitute.com. Before I read the fifth peer reviewer, I'd like for you to know that when I started studying Chinese medicine in 1994, it wasn't like this. We didn't have access to, we didn't have YouTube, we didn't have the internet, we didn't have so much, vast knowledge, and we didn't have the education that we have today in the sense of really elevating our profession. And the fact that there is this journal that's giving so much love and knowledge and education and sharing these people who are so well talented and highly educated. In my doctorate program, I shared that in, over a couple of decades, 2 decades worth of treating people, since 1999, I'm seeing, and it's now 2023, the texture of this medicine has changed tremendously, as well as the value of our practitioners. So thank you for sharing who you are and, what it is that you do and how what you bring to the table. I really appreciate it. Dr. Charisse Wolf. I don't know if I'm naming her correctly, if I'm pronouncing her correctly. I apologize. She's a DACM and an L.Ac. Dr. Charisse Wolf has been a licensed acupuncturist and herbalist for over 15 years with practices in California and Washington. Her undergraduate degree is from UC Davis, MS TCM from ACTCM, and doctorate from 5 branches. She has experience with biomedical as well as acupuncture research and currently serves on the board of directors of the American Society of Acupuncturists as the vice chair and board liaison to the research committee. Her practice style focuses on classical Chinese medicine principles while seeking to create bridges between the classical Chinese medical philosophies to modern clinical and complex systems research. Along with her practice and board work, she also teaches continuing education classes and is adjunct faculty at the Seattle Institute of East Asian Medicine and Middle Way Acupuncture Institute. So I'm just going to review some of these, and I'm going to name and read the authors again, especially those that I did not go over. Acupuncture in East Asian Medicine and Integrative Oncology by Dr. Janie Yuen Tsao. Remember, she was the one who, her training at Harvard Medical School. And Chinese Medicine, Oncology, and Immunology, Colorectal Cancer, a Case Study, Dr. Erlene Chang, and some co-authors whom I did not reference. So besides Dr. Erlene Chang, I apologize if I'm not naming you correctly. There's a whole bunch of people that I want to make sure that I cite. Dr. Ana Paula Duarte. Ana Paula Duarte, or Ana, DACM, L.Ac, Diploma of Acupuncture. So that means she's a doctor of acupuncture and Chinese medicine. She's a licensed acupuncturist and she's board certified in acupuncture. She's been practicing traditional Chinese medicine for a decade, and she is currently serving her local community in Los Angeles. She is a generalist practitioner and strives to treat and refer as many people as possible to this incredible medicine. Then there's Ana Hortilosa She is a doctor of acupuncture and Chinese medicine and a licensed acupuncturist. She's been practicing Chinese medicine in San Francisco Bay Area since 2012. She specializes in chronic conditions and mental emotional wellness. In addition to private practice, she works on community and public health initiatives in Berkeley, California. And then there's Daniel Metzger, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist, specializes in gastrointestinal and hormonal health using an integrative approach. He works in private practice in San Francisco. Then there's Denise Visconti, if I pronounce that correctly, Doctor of Acupuncture and Chinese Medicine, Master of Acupuncture and Oriental Medicine, Master of Science in Chinese Medicine, has practiced, taught, and researched TCM for nearly 20 years. She specializes in chronic multi-system disease states and is researching herbal treatments for diabetic neuropathy and nephropathy and cancer using TCM genomics. Amy W. Sparrow, DACM, Doctor of Acupuncture and Chinese Medicine, Master of Science of Traditional Chinese Medicine, National Diplomate in Oriental Medicine, Masters of Arts in French. So, I majored in French a very long time ago. I don't speak French like I used to. So, hello, Dr. Sparrow. Amy has a private practice in Sebastopol, I think that's how you pronounce it, and works at the Kotati Community Acupuncture Clinic. She enjoys family practice medicine and further specializes in neurologic and chronic disease. And then there's Jasmine Rose Oberst, DACM, L.Ac, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist, has been in practice since 2005 and is licensed in states of California and Hawaii. She has an integrative Chinese and functional telemedicine practice, specializing in digestive health, energy, and healthy aging. And then we have Huang Tran, Doctor of Acupuncture and Chinese Medicine, Diplomate of Oriental Medicine, and licensed acupuncturist. So he's board certified and he's licensed, specializes in psycho-emotional cases at Dongguk University, Los Angeles. He is passionate about promoting TCM integration in the U.S. healthcare system, particularly for mental health, having served as the academic director for the American Institute of Mental Health in TCM and a committee member of ASA. I think ASA stands for Acupuncture, American Society of Acupuncture, ASA. American Society of Acupuncturists. Let's see. Ji-Yoon Look Kim, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist, has been practicing acupuncture and Chinese medicine and is currently practicing at Huntington Station in the state of New York. He specializes in mental and gastroenterology. And then there's Sherry Martin, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist, and MBA, Master of Business Administration, is a specialist in the treatment of neurological disorders and pain. She is the owner and practitioner at 3T Acupuncture and Wellness in Honolulu, Hawaii. And then there's Shanae Yun, Doctor of Acupuncture and Chinese Medicine, licensed acupuncturist, has a practice in San Francisco and San Bruno. She specializes in pain management and women's health. And last but not least, there's Ivan Castillo, Doctor of Acupuncture and Chinese Medicine, is a Marine Corps veteran. Thank you for your service, Dr. Castillo, an acupuncturist who practices in Paso Robles, California. His practice includes and is complemented by herbal medicine, sound healing, and meditation. Quite impressive. So, we described who Dr. Annette is, aspects of immunity and cancer in an integrative medicine complex. And we described who Dr. Hoffman is with cancer terminology and Chinese medicine texts. And we described who Dr. Kim Pirano is several times, the transformative role of Chinese medicine and acupuncture in palliative and end-of-life care. And we described who Dr. Bethany is, Dr. Erlene Chang, and her corresponding author and the other co-authors. The Integrative Medical Treatment of Ovarian Cancer Stage 3, a case study. And we described, I think there's one more, acupuncture for treatment of post-radiation skin lesions in a stage 4 triple positive breast cancer patient, a case study by Lisa Nicholson. We described her. So please pick up Journal of Acupuncture and Integrative Medicine. I'm going to end this on one case that I treated many years ago. If you go to elementsinharmonyacupuncture.com, go to cases, kidney disease stage 4. I have so many other kidney disease cases, but I will share it here. Kidney disease stage 4. This woman was in her 50s. She did not want to go through dialysis, so she came here. And in 1 month and 7 days, I got the GFR from a 30 to a 90. She did 19 treatments from March 3, 2018 to April 10, 2019. Go to elementsinharmonyacupuncture.com/stage 4, the number 4, dash kidney disease. And let's see. A GFR of 60 or higher is in the normal range. A GFR below 60 may mean kidney disease. A GFR of 15 or lower may mean kidney failure. According to the National Kidney Foundation, normal results range from 90 to 120. Older people will have lower than normal GFR levels because GFR decreases with age. Normal value ranges may vary slightly among different laboratories. So there's that. And I have other cases that are just not on my website, but I've treated people with, they show me their numbers, liver numbers, bilirubin numbers, kidney numbers, blood pressure, cholesterol, blood glucose. Acupuncture is very, very helpful. White blood count, red cell blood count, red blood count, platelets, name it. I usually can affect the numbers, and that's when it's really great. When a person comes in with these diagnostics from their medical doctors, and I have to do something with it. One more thing, I just love to give people statistics of how great Chinese medicine is. If you go to my YouTube channel. What is my YouTube channel? It's my new one. And it's youtube.com/c/Anna Dolopo -Elements in Harmony /videos. And one of those videos, you'll see a 5% chance to get pregnant, 1 fallopian tube, 4 failed IVFs, AMH was a 0.16. It needed to be a 1 to 4. Fertility specialist recommended donor eggs. 5% chance to get pregnant. Over 40 years old. Mommy and daddy received acupuncture. Did Qigong with me. Followed my protocol. I asked for 2 to 3 years. She got pregnant naturally with her own eggs, their own sperm, own everything. 6 months. And I will tell you exactly how much she paid. She paid for under $9,000. And then there's another one. That's what acupuncture can do. There's another one on sperm. Well, you can go check it out. We went from 2% to 72%. It needed to be 40% threshold. I got it to, I believe the first video I shared, it got to 42% in 20 treatments in 2 months, I believe. And then we went longer, more months, still helping the mommy. And one paper, there was a study done in Texas showing that 40% is good, but 50% motility is even better for the sperm motility. I got it to 72% in 10 months. So that's what acupuncture can do. I don't think I'm going to do another video for a while on acupuncture, integrative medicine, oncology, integrative oncology, improving care with acupuncture and East Asian medicine. I'm probably gonna, I'm probably gonna share this video with each of those doctors. This is a very long video. I don't expect anyone to watch this whole video, but I did it, and I want to just give homage to such great work. And there are so many of us who've either, you guys are in battle, you guys are healing, and you're doing whatever you feel is right for you. There are other types of health issues that I'm going to discuss, multiple sclerosis and other autoimmune issues, but today we talked about how acupuncture and Chinese medicine can be very, very beneficial for people who are suffering from cancer symptoms. Let's go to one more, PubMed, because that was great. That was a great article. Let's go to the next one. Acupuncture for palliative cancer pain management, systematic review. Let's see if it's something positive. Ah, yes. PubMed.ncbi.nlm.nih.gov/33441387. I did not cite who the other doctors were, so you can see these researchers. Acupuncture for palliative cancer pain management, systematic review. Conclusion: acupuncture may be an effective and safe treatment associated with pain reduction in the palliative care of patients with cancer. Further high quality, adequately powered studies are needed in the future. But that's a step in the right direction. I'm really glad that these things are, in light. So, my name is Dr. Anna Catherine Navida Dolopo. I practice in Elements in Harmony, Acupuncture and Chinese Herbs in beautiful Laguna Hills here in Orange County, Southern California. I've been in practice since 1999. I'm board certified, and I'm a licensed acupuncturist. I'm a doctor of acupuncture and Chinese medicine, and I've been practicing since June 22, 1999. And to my colleagues, again, thank you for your hard work. Thank you for the long hours. It's a lot of work just to be in practice. And the fact that you put in so much commitment and dedication to this research. Research is a beast in its own. I appreciate you. And to my patients who are watching this, and if you made it this far, God bless you. And I'm just doing my part here. If there is such a thing as, preventing cancer, by all means, if that's possible, I would like to think so. Healing with Whole Foods book, I strongly recommend it. We discuss that when you're here as a patient. All right. If you'd like to check me out, go to elementsinharmonyacupuncture.com. And for those of you who are doctors of acupuncture and Chinese medicine, doctors of acupuncture, oriental medicine, licensed acupuncturists, whatever your titles are, I also teach the business acumen of successful acupuncturists. Go to successfulacupuncturist.com. And you can text me or telegram me at 1-619-341-4341. And my office number is 949-305-1703, but it always goes straight to my cell phone. So you can text me, telegram me anytime. I do turn off my phone. So one thing to consider is turn off your phones. I do recommend that you get high quality shungite. I have shungite all over my office, all over my house. Very, very high quality. And we can discuss that privately. So turn off your Wi-Fi as much as possible. All right? Okay, take care.